Had a lot of people ask about, chemotherapy and why we chose to use the chemotherapy. It's so hard on your body, and I don't know. It seems like maybe in the Christian world, especially, there seems to be a hesitance to that, and trying to lean on more natural type of remedies and things like that. Here's what I know about the natural remedies. Everyone I know that has tried it has passed. Some of them it's taken several years, but they've passed. My wife's particular type of cancer, someone was saying ivermectin cures cancer. Well, that may be true for certain types, maybe colon cancers, especially colorectal cancers. But the type of cancer my wife has, called TNBC, triple negative breast cancer, it has a high rate of recurrence. It has a high tendency to what they call escape, and what they mean by escape is it gets away from the stem cells, get away, and they break loose, and they'll be found either in the liver, the lungs, or the brain. And if that happens, there's no markers, nothing, no tests that they can make for it. So if that happens, by the time they find the tumor, because it grows, it doubles every 100 days, doubles in size every 100 days. And and by the time it gets to those areas, it will be basically stage 4 before they can find it, and it'll be inoperable or incurable, and sometimes inoperable even. And so really the only chance to defeat this cancer is to get it right away. In my wife's case, there is a high probability, 80% chance, that they got all of the cancer in surgery, and then we're using the most aggressive chemotherapy available, which is only 50% effective with TNBC. We're using that, and that increases the needed chance that the cancer will not recur, up to from 80% that there'll be no recurrence to 90%. And so we feel like we want to give her that opportunity. If in fact it doesn't work, if there was some cancer stem cells that escaped and it does not work, her prognosis for living is doctor said, he's got one patient who's made it 5 years, but it was a battle. It's been a battle all 5 years. And it's just not the way we'd like to be able to make this work. We'd like to be able to treat it aggressively and hard right at the beginning, and prayerfully that will make it so that she won't have to address it in the future, at least for a number of years.